Hi, folks. Hi, viewers. Welcome to another episode of Consent Dojo. And apparently, this is episode 48. We've been going on for over 4 years, and I am delighted because here we are building our consent muscles because it is not easy. And it is every day, all the time practice, but it's the kind of practice that we get building our consent muscles. It's going to make us not only better people and better society, but it allows us to have better fun and less doubt. Because doubt is confusing and frustrating and not so good. So today I am excited to have a guest that I am newly getting acquainted with through the lovely network and web of the therapist world, which I've been dipping my toe into or getting onto the web of it. I've been looking for somebody to talk about, well, discussing and teaching young people about being savvy with consent. Now, me, I don't have kids, right? And I tend to be swimming in an environment that is mostly grown-ups who mostly behave like children, but they're actually legally grown-ups. Uh, and because I'm in San Francisco, and this is one of these cities with very low number of kids and minors, uh, I don't have a lot of exposure to the challenges of raising consent-savvy young people. And it's been something that I've been curious about. And as a 21st century sexuality educator, it is interesting that it is the first time in human history that those of us who are speaking about sexuality and pleasure get to separate from fertility and parenting, which is historically an amazing period. And I'm also incredibly ignorant on this topic. So I've been looking for somebody to talk about this. Um, so I would like to introduce Dr. Megan Parker, and I'm going to bring her onto the screen here and add spotlight. Welcome, welcome to Consent Dojo. Thank you for consenting to coming on.
Thank you, Midori.
Now, now I could just read your bio, or people who are signed up can read the bios in the section here. But how about, in your own words, tell us who you are and what you do.
Sure. So I am a licensed psychologist in the state of California. I've been practicing, you know, throughout grad school, so it's been about 17 years total. And right now I work in private practice, and a lot of people that I see are individuals at this point, but I started out working with families for the first 13 years of my career. A lot of anxiety. That's kind of my wheelhouse and parenting. A lot of overlap there. And I do a lot of parent coaching at this point. So, um, teenagers, young adults, parents. That's kind of where I am at this point in my career.
And how did you end up specializing in your population?
Oh, back in the day, I was 14. I was like, I'm going to be a psychologist. So, um, I went along doing all the things to become a psychologist, and I was like, this is going to be great. And you get into grad school, and they're like, well, what kind of population do you want to work with? And I was like, I do not want to work with kids. Then I got my first placement with children and absolutely fell in love with it. And honestly, looking back, I'm not surprised. I was raised by two public school teachers and just really grew up in a household that was child focused. So looking back, it was no surprise that the child placements just really clicked with for me. When I got into private practice, I thought, I want to keep doing that. So I started working mostly with families. I specialized in children 0 to 5 for the first 5 years of my career.
Mhm.
And then I started transitioning up to about ages 21 because I had taken a position working with kids in the foster care system.
Mhm.
And the system here supports people until they're age 21.
Mhm.
So it just kind of clicked for me. I loved it, still love it. Happy to be doing it.
And we are grateful that people like you are out there doing that. Now, to the viewers who are here live, I invite you to put in questions into the chat box or the Q&A, or if you're going to put it in the little chat field, make sure you put Q colon, so you can also chat amongst yourselves and bring things up. So, because I want to make this available for this unique opportunity available for those of you who are here live. Okay. So please feel free to ask us questions. Now, I want to dive into your current state of your practice. Now,
Sure.
it is in the after times, after COVID and all that. Uh, and I am hearing a lot of my friends who are caregivers and responsible for younger people. And for those of you who are viewing, I'm saying it particularly that way because not everyone who is taking care of young people are necessarily parents.
That's right.
So I want to also bring that up. But I'm hearing a lot of frustrations and the world very much changing from when my peers were children themselves. So what are some of the common challenges that your clients are bringing to you about raising young people to be consent savvy and good humans?
I would say the most often, gosh, the most common issue that I see around consent really is about, you would think teenagers, but I get more questions about toddlerhood than anything else. And that's understandable because that's the time in life where kids are testing out other people's boundaries. It really is a great time to be diving into consent with your kiddos and starting to teach. I really believe that starting as early as possible to around consent, ages 1 to 5, is where we really want to get an early start, particularly around bodily autonomy.
Hmm.
And parents will be like, I'm trying to teach my toddler about bodily autonomy, and there's some really great books out there. There's many books on bodily autonomy. I did include a resource link for people who are interested in that for ages 1 to 5. But it kind of brings up the conundrum.
Hmm.
How do we teach bodily autonomy and consent while actively having to push against their bodily autonomy and consent?
And now, to clarify, can you expand on what bodily autonomy means in this case?
Sure. And I'll throw in there too, when we're talking about kids, we're not just talking about consent because technically consent isn't a thing with children in my world. It's assent. That's what we're really looking for is assent versus consent. But when we're having these conversations with our children, we should be using the word consent. Consent is, for me, a legal term. We're really talking about assent. We're trying to get their permission. We're trying to get agreement from them to participate in a thing. So, um, bodily autonomy, when we're talking about young children, we're talking about how their body is their own, where the boundary lies with their body. So this would include touch, whether they're touching someone or someone's touching them. Um, Bodily autonomy, like what they're able to do with their bodies, what they're not. We're really talking about you get to have agency over what happens with your body while simultaneously being like, yes, you have to take a bath. So that's the example that I usually run with for folks, um, is the bath time scenario, or in sometimes the pediatrician scenario.
Hmm.
Bath time, visiting the pediatrician, these are times where their bodily autonomy is going to be challenged. So, oh, it's bath time. I don't want to. No. But you've been having these kind exactly. You've been having conversations with your kids about bodily autonomy, and no means no. And they're like, no. Well, they're 3. They have to take a bath. So, exactly. So the challenge becomes, how do we teach bodily autonomy while simultaneously saying you have to take a bath? How do we get their assent, their agreement to participate? And every child has kind of a different scenario going on. Parents have different scenarios going on. So the route a parent might take to address trying to get a child's buy-in will depend on the kid and the parents and kind of the family culture.
Mhm. Now, the common answers for so many things around interpersonal relationship, whether, it's my field or your field, it depends is an answer that comes up a lot. But I also recognize that it depends, it's subjective, it depends on the individual's family or people involved. We know this, and yet it's nice to have examples. Now, accepting that there's no one true way, right? I'm assuming.
Can you say that again?
Oh, there's no one true way.
I agree with this.
Right. So what I'd love to hear are some of the stories around strategies of navigating this. And assume,
Hmm.
yeah, I would love to hear your stories.
So let's remove dangerous situations, because right away we're just going to remove that category, because in dangerous situations, I'm like, you're going to violate your child's assent for their safety. You just have to. That's just the way it is. But
Running scissors.
running with scissors, walking away unaccompanied,
Mhm.
right? You're gonna child's beelining it, because I don't know why 4-year-olds are so fast. I don't know. They're just, you're gonna snatch them up as you should. So let's take all the dangerous situations out. Let's run with the pediatrician scenario, because I have so many pediatrician stories, right? Um, and a lot of pediatricians do genital checks, right? Or um, a a story around a child uh, was having skin yeast infections, right? This is very common in toddlers, little skin yeast infections, and lots of times it'll be like right where the leg meets the torso. We've been telling our child, if a stranger touches you anywhere a bathing suit covers you, you should tell another adult. So, okay, we need to start preparing our child for this pediatrician appointment.
Mhm.
And this child in particular was like, she was just kind of like, I don't know. I don't know. It's this, she was really in this existential, she's 4. She was in this existential place about, is the pediatrician really a stranger or someone I know? I don't know. And her mom sat down with her and discussed exactly what would be happening. And she was able to go in. She was a very precocious kiddo and was like, Doctor, are you a stranger? Just, and the doctor was like, well, this is our third time meeting. What do you think? And, the child sat there for a second or two and was like, I don't really want to get to know you better. But I'm going to let you check this out because it's really itchy. And she was able to just flow with it. But the parent allowed space for the child to say something. Now, again, this was a precocious child. She wanted to speak to the doctor herself. Some children at that age, they're anxious. They
Mhm.
want their parent to speak up. But that's just kind of a story where you know parents were trying to get assent from the child. And in turn, as she gets older, her understanding of assent and consent is developed and influenced by her experiences with this doctor, with her parents, of her having agency in this moment. So really, we're trying to get them to start early with bodily autonomy, um, despite the fact that, sometimes we have to push against their bodily autonomy for their safety or their care. And in doing that, we kind of help them internalize how to set good boundaries as they grow up. Oh, I need to do this in order to take care of myself.
Now, it sounds like in this example, and I was thinking back to me as a kid in the doctor's office. Oh my God. Um, Many of us watching this come from the childhood of because I said so, because I'm your parent
Yeah,
generation, right?
yeah.
And in the example that you gave, uh, really patient process of explaining the process, giving the kid space to engage with the doctor. This is a lot of patience. And from what I observe with my friends who have little ones, patience seems to be an often negative supply. So
Yes.
this also seems to be about, much of this seems to be about how the caregiver navigates the reality of their, well, fraying nerves and lack of time. How do you advise on that reality?
That is one of the toughest things about being a parent, especially in this day and age where people are rushing. There's ballet lessons, there's choir, there's the parents' own pursuits, there's the house. And this is going to come up a lot probably in this conversation, but it has to, how do I approach this? When I approach this with parents, it's about values.
Mm,
If you want to teach your child about assent and consent and it requires patience, reflect back into your own values as a parent. What
mm,
is it that you want? Do you want to teach kindness? Do you want to teach patience? Do you want to teach reflection? If that's what you want to teach, you have to embody that in your parenting. And you are going to fail. You're going to fail at times, and other times you're going to succeed. And your kids are watching you. So in some ways, it's important that they see you fail at times
mm,
so that they can see you do repair, so that they can see you come back, so they can see you take that deep breath and count to 10. Oh, I couldn't get little Johnny to put his jacket on. He was asserting bodily autonomy. No. Yeah. And parent is Johnny's going to be late to school, parents going to be late to work. You know, what they want to do is just cram his arms into his jacket. Yeah, or just zip him up in it with his arms, kind of, straight jacket it. But, you know, yeah, you're going to get impatient. You're going to snap. And if that's not what you want to show, is that's not in alignment with your values as a parent, to make that repair is something important for your kids to see. I think that's especially important when we're talking about consent,
Mhm.
because breaking someone's consent requires repair. Breaking someone's assent requires repair. So, yeah, parents will fail and they'll succeed, both.
Right. So on the repair thing, and given that this is, I've been talking about consent with various experts and perspectives for 4 years, the repair part is, I there's not, I feel like there's not a whole lot of discussion or training on that. And I have noticed that we are a perfectionist culture often, must do things right, right? So
Mm,
navigating screw ups and then how to visibly repair that, it feels like that's not all that addressed. Even in my arena around adult to adult and intimate situation consent, I think it's still at a very sophomore entry level, and we're not talking about beautiful repair. How are you encouraging the adult caretakers of minors to accept imperfection, and how do they repair? What are the options? I mean, do you have any stories around repair successes and repair
mm.
stumbling?
I think that you're right. Our society is, we have to be perfect, which sets us up to experience shame when we make a misstep. And when children start from a young age, particularly seeing their parent make a misstep and offer repair, they start to internalize that as a normal and human thing to do. It's a kind thing to do, to accept that you are flawed and to take accountability for the mistakes that you make along the way. So I have a story that's not so much about a parent that is about a teenager, but because of his parents.
Mhm.
So his parents, very young, started teaching him about consent and bodily autonomy, and not just consent as a body issue, but consent as like what you're looking at, what information you're sharing about someone, things like that. Well, he became a teenager and he pushed through someone's consent
Mhm.
at around 16. And the next day, he had a conversation. He went to his parents and talked to them about it. He came to me, he talked to me about it. Ultimately, we did not tell him how to repair that. He made his own decision to see if this person was willing to speak with him. They were. He took accountability. He lost 3 friends for 2 years. They did circle back to reconnect because he took accountability, because his parents had started at such a young age with him around bodily autonomy, the sharing of information like privacy versus secrets. That's very connected to assent and consent. Um, and his parents had made repairs with him over the years of like, I'm sorry that I picked you up, and this was when he was much younger. I picked you up and had to just put you in the car to go. Yes. Um, and of course, he was of an age at that point where they shouldn't have been doing that. And he was like, really standing his ground. And they did what was right. And they repaired about I had to pick you up and but because they made these repairs over time, and sometimes the parents really did make miss big steps about his consent and assent, but they always came to him and made these repairs. So I've seen the end result. I've seen this in a few other clients too, who I started seeing very young, who are now in college.
Mhm.
Um, how they're able to come in to friends and family and not be defensive and say, yeah, I messed up.
So the thing that comes to me is then training parents or the adults, the caregivers, on how to make repairs, how to acknowledge when most of us who are now in caregiving age haven't been trained in this, right? So having to train the adults in this, which is also why I was interested in having you on. Um, wow. Okay. So are you up for one of my personal stories?
Sure.
Okay. So I was born and raised in Japan, and the social norm in Japan is not touchy. When you greet somebody, you bow. You don't shake hands, much less hug, right? And so I'm a kid starting to come over to the States to visit my American relatives. My white American relatives who, to my tiny Japanese statue, were already, I mean, they were all like the tall side of the family, which I didn't get that gene. I mean, they were all like, the women were like 6 feet tall, right? And so I'm this tiny little thing, I'm showing up, and they are, from my perspective, these giants speaking things I don't understand, swarming in and giving me hugs. And as a good, well-behaved Japanese kid, I shut up.
Mm,
I was also in terror because these were behaviors that I did not know. And it was overwhelming and frightening. But then I was told that these are your relatives. And it's like I'm looking around going, okay, this is what I'm supposed to be doing. But I'm kind of freaked out. And I did not have the skills, nor did I have the adults around me to recognize that I was like, and because I did not hug back and no one was aware of the cultural difference, I I'm sure I made some weird impressions on the adult American adults. Um, and it was never a discussion around bodily autonomy. I did not get a choice in this matter. And
hmm
even as going into tweens, so that was it obviously made a very negative impression because decades later here I'm talking about it. The cultural differences. Uh, does that ever come up in your office?
Yes, 100%. Um, Cultural differences, you know, based on uh, where someone's family is from outside the United States, internationally, within the United States, because you can probably hear I was raised Southern, and, you know, it's very different there than, say, here in the Bay Area.
Mhm.
And then, even on a smaller micro level, is the family's culture of what is considered normal and what is not within that family's unit. And when there are differences in culture, that's okay. Um, we navigate it depending on what the family's culture is and what's appropriate. It kind of links back to uh, perfectionism. Um, no matter what the culture is, no matter what's going on, as a parent coach, to try to meet my clients without judgment,
Mhm.
whatever their cultural practice is, whatever their shame is around snapping at their child. If they're trying to learn, be more attuned to their child, then I have to meet them with where they're at and without judgment.
Mhm.
And cultural expectations um, are so varied, you know, where some people find certain cultures cold, other ones find them very invasive, um, and trying to prepare children for different scenarios and how to say no, thank you in the best way they can, and to have their parents back them up on that. Um, and how to handle, adults that are not attuned to them.
Mhm.
Great Uncle Aggie, might not be attuned that this child is trying to like get away, and their primary caregivers may not be there. So helping a child feel like they can do what they need to do. Sometimes it's, yeah, that no. Sometimes it's a quiet slipping of like, I'm just gonna go over here. Yeah, and to be like, it's okay. To just let your ch child know, like, it's okay. If you say no, it's okay if you want to do a quiet slipping, quiet quitting. That's kind of a new term for
I would,
what's going around.
yeah, I would have appreciated looking back. 'Cause I think the adults around me, super smart people, just kind of assumed that everyone knew everything. I,
Mm,
I'm 5 or 6, you know?
yeah.
Would have been nice had I been briefed on this is how our relatives over there do things. That would have been really helpful. Yeah.
Preparation, meeting new family members, going to another culture, traveling,
Mhm.
going to the pediatrician, going to school, as much as we can prepare them. And this means not just one conversation. Midori, you were like 5 or 6. That requires probably 3 or 4, maybe more conversations before you meet those relatives.
Oh, hell, it requires that much for me now. Yeah, somebody comments that, yes, I think it's a conditioned perfectionism that needs to be addressed in order to allow for repair when it comes to parents and caregivers.
Hmm.
Yeah.
Yeah.
I
And how to meet, if the perfectionism is conditioned, like it is for most of us, can we meet those folks with as little judgment as possible? Can we, if they're wanting to embody patience, acceptance, kindness, non-judgment of their children, can we meet them with that? You know, for them to embody it, sometimes they need to see us embody it for them.
mm, I see another question, and I also have this question as well. Uh, secrecy versus, what was it? Secrecy versus privacy, I think.
Privacy.
Yeah. Could you talk about that and maybe even a story or two?
Sure. So I would say that secrecy versus privacy is very connected to consent and assent, right? First, definitions. Secrecy is when we don't tell something because of it causing problems, trouble. Secrets tend to cause harm in when we're talking about consent. Privacy is usually more about things that are for us. They don't harm us, they don't harm other people. And um, I worked with a lot of children that experienced sexual trauma, and secrecy was how this happens. where adults can convince a child to keep a secret, right? So we talk about privacy versus secrecy with children. Again, I'm just going to say it again, secrecy, harm, privacy, non-harm. This is the boiled down, simple, oversimplified even difference between the two when we're talking about children. So parents are like, well, how do I teach my children the difference between secrecy and privacy? Good question. I like to give this story from my own life. So I was raised by two public school teachers, and uh, my mom, she's a K through 12 teacher. She's all about kids. So when I turned, I guess maybe 6, old enough to read, she started having my grandmother, who was also a public school teacher, and by public, I mean one room schoolhouse. My grandmother started sending birthday cards in the mail. Super fun for a kid. Oh, I got mail. But they wouldn't open it. They would wait until I got home, or they would pull it out of the box and be like, "You have a piece of mail, Megan." Right. So eventually, what I realized was happening was that she or my dad both would immediately go and open their mail. They would never open mine. This is how they were teaching me about privacy in the very beginning of you, this is yours. And even though I know you have it, it's not a secret, but it's not mine to open. It's not mine to know what's in there. And that was the first time I really understood what privacy was,
Hmm.
right? I think when they're toddlers, we try to get them to understand privacy, like, no, you cannot take your pants off in Target, you know, like everyone wants you to respect your own privacy. Please put your pants on, right? Um, so privacy versus secrecy. When they start getting older, 7, 8, 9, there's like um, these school-aged children, and they're starting to whisper and they're starting to have secrets, right? What they're really doing is, gossiping. And sometimes it's not gossip, sometimes it's genuine harm. So, helping our children be able to differentiate between what is something that's harmful and something that's not, because that is the difference between privacy and secrecy. So, does that help? I mean, it's such a rabbit hole, privacy versus secrecy, but does that answer the question?
I think it's a good start. Now, that led me to thinking about parental responsibility with privacy versus secrecy on data and digital communication. I'm sure that's
Hmm.
been coming up.
Yes, quite a bit. I see it mostly in two areas. One is bullying, and the other is pornography.
Hmm.
So at this point, particularly with the way online bullying is just getting stronger and stronger, if parents feel called, I don't really have any judgments. If they put software on their children's phone to be able to see what's happening, I don't judge them for that. I don't judge them for not doing it. They need to make the call that they feel like is good for their child. And different situations call for different interventions. But to allow the child to know, like, your devices are being monitored.
Mm.
And you may not always know when I'm going to look and see what you've been doing on your device, but kids will often hide online bullying
Mhm.
from their parents. This is a secret. This is not privacy. And so sometimes, parents do need to intervene with a software that surveils their child's devices. And I think I've only had one case where I was like, you should not tell your child, but in every other case, I'm like, you should tell your child that you're surveilling their devices or that you're checking their devices. Um, and so far, not a single kid has said no. They're like, okay, yeah, because, something might happen and I feel too scared to tell you.
In many ways, the current digital natives are far more sophisticated than when I was their age. Oh my goodness.
Hmm.
Yeah. Um, yeah. And the the surveillance as well as the minding of. Yeah, it's that I have a diary and you went in and read my diary,
Hmm.
having the heads up, I suppose.
Sure, there are parents that will go into their child's room and search their child's room. And I'm like, do you tell your child you're doing that? Because again, this is assent. Children cannot consent. Parents get to make the call to search their child's room. Right or wrong, it doesn't matter. They get that is their prerogative.
Mhm.
Reading their child's diary. Again, is it right? Is it wrong? It is still their prerogative because children cannot consent. They can only assent. They can do this without any repercussions except for their child being angry with them. And it can undermine the relationship, right? And then it's like, well, now is your child going to come to you, right? We want to set you up to succeed from toddlerhood on up so that they don't feel like they have to keep things from you. That whatever's in their diary, they're already, if it's something big and important, they're already going to come and tell you about it because they're going to be met with as little judgment as possible. So, you know, again, secrecy versus privacy. And with devices, that's a little different than, say, the diary, because no one's in there making comments on your diary. No one's in there belittling you, except maybe yourself in your diary. Whereas on devices, yeah, people can be harassing a child through a device.
Okay, so I'm imagining a situation of an analog diary. So, in other words, not others inputting,
Hmm.
could be, if I were concerned about my kiddo's self-esteem or uh, self-harming or substance use or school issues, or maybe they're talking about being bullying in their analog diaries, what would you say to that parent?
Before they get into the diary or after?
Let's say before.
Hmm. I think my professional approach would be to help the parent try to massage the conversation with the child before going to the diary. I
Mhm.
feel like that is um, one of those last ditch efforts to really find out what's going on. Lots of times, even the diary isn't going to give you the information you want. So, but let's assume it does. Um, it's it's definitely going to be a invasion of privacy, and with that parent, I'll be like, let's talk about what you gain, the pros of going through the diary. Let's talk about the consequences of going through the diary. because you are undermining the trust that your child has in you. So we go through the pros and cons. And then after that, be like, is there a way to approach this in which we can massage a conversation in where the child feels safe enough with you to talk about this, without having to violate their assent or their privacy? Because maybe they are keeping a secret from you.
Mhm. Mhm.
So how can we get that information? Let's try these other routes first. And then ultimately, I don't tell them what to do. We explore the pros and the cons, and then they get to make their choice.
Okay, let's surmise the same analog diary situation, yeah?
Okay.
Or it could be anything similar, but let's go with that one. Let's say that your client is the young person whose diary was uh, trespassed upon by caregiver. As a clinician, how are you working with that child?
With the child, not the parent.
Yeah,
So if the child, I want to make sure I understand that. If the child comes to me and says, my parent got into my diary. Yeah.
yeah.
Yeah. Um, what are your concerns? Are there secrets? You don't need to tell me. Yes or no is fine. Let's talk about your consent and assent. Let's talk about your feelings. And then once we go through all of that, to say, how would it feel to talk to your parent about all the things you just talked to me about? Because again, we're coming back to trying to help the attachment, help the connection, so that both parental and minors, both parties feel like they can lean into each other and trust that the other one's being honest when things really need to be said versus this is private. So I'd want to explore that with that teenager, like their feelings, but also what were the consequences?
Mhm.
Did it get them thrown into a rehab program? Right? Did it get them put into an eating disorder program? Is that why they're seeing me?
Yeah.
What were the consequences and what kind of anger comes up and what would they do if it was their child?
Now, let's assume for um, no serious issues, but just that there's that teenage wanting to establish themselves era and that sense of just betrayal, right? So let's say that there isn't significant behavioral,
Fallout.
well, yeah, just the this is my private diary or my private whatever. This is my thing, and um, I am, let's say, 13, right? And you just did this. I hate you, mom.
After mom has been into the diary. Yeah. Okay. I mean, it's a 13-year-old, they're going to express, if they're expressing an emotion like that, at least there's that.
Mhm.
It's more concerning to me, it's more concerning when a child is actually shutting down and not saying anything. I'd take the I hate you over the shutting down almost any day. But again, exploring those feelings. Hey, should we invite your mom into this conversation? Would you feel comfortable saying these things to your mom? What is going on? And it kind of, that particular scenario makes my brain circle back around to almost that conditioned perfectionism. Why is mom into this? There's no reason to think there's drug use. There's no reason to think there's self-harm happening. There's no reason to think harassment or bullying is happening. What is going on here? What is mom actually looking for? Is she thinking there's things that need to be tweaked? Is she thinking that she failed in some way? What is going on here?
Hmm.
Right? Because it's often in that case where there's not some sort of red flag going on for a parent to be snooping. It kind of makes you start to wonder why did that happen? What's going on with this parent? Um, what are they struggling with inside their body? Because we say that emotion primes behavior. What was the emotion? What was the feeling in the body that pushed the parent to snoop into a diary and push a child's boundary, push past their assent? Um, because it's going to eventually eat away at their relationship with their child. And if we can get in there and try to make some repairs to that, the sooner the better.
Hmm. Okay, so let's assume for that mom, the really no issues 13-year-old diary, mom has the scenario you're just talking about. What would you advise that mother? Let's say the mom is in the office with you.
Mom's in the same scenario, but mom's sitting there.
Yeah.
Yeah, that can be hard for parents because they've realized that they've misstepped. And again, coming back to that, I'm going to defend my decision because I have to be perfect. When really what the situation may call for is repair and accountability. And for teenagers, particularly, this is really important for them to see because they're already in a state of development of trying to individuate and separate from the parent. Hard. So, okay, we need to get the parent to kind of have an empathetic understanding of a 13-year-old's experience, which brings us back to once again parental values.
Ah, okay. Right.
Is it, are you trying to raise an empathetic, reflective child with kindness and patience? Then this is your time to shine, parent. You made a misstep, and this is your time to show that you can drop your defensiveness. You can have kindness. You can have empathy with your 13-year-old who's expecting you to be defensive.
Okay. All right.
So this is the we're taking a misstep and we're using it as an opportunity.
Ooh, that's going to be hard for some parents and some adults.
Sure, it is.
Yeah. I want to get back to the discussion around the parenting values, but you sent several resources, and for those of you who are viewing live, we'll put the resources in the chat box wherever it is for you. And for those of you who are viewing this later in the recording, look down below for the various resources that Dr. Megan sent us. One of the resource was a cool little video, and I'd like to share that. For those of you here live, I hope you don't mind. We're going to do a little story share. Let's make sure that I also have the sound playing. So when I start it, you all, somebody let me know if it's working. Okay. And so, ah, Dr. Megan, good for that?
Yeah, let's do it.
Oh, wait, let me fix this. Let me, okay. I'll do a little tweak here. Oh, Wait, sound.
But it's important, conversations like the birds and the bees, for example, or how to behave when you're out in public so you don't embarrass your mum, that sort of thing. Well, today we're going to be talking about consent, okay? And I'm going to use my take on the famous tea analogy to get my point across in a light-hearted but informative way. So as always, if you like this video and you think it'll help your teen, send it to them and spare yourself the uncomfortable silences, okay? You're welcome. Riley.
Mum, it's Sunday. Even God took a day.
Right, well, I can't take a day off. I'm your parent. We don't get days off. Now, listen, today we're going to be talking about something very serious, okay? We're going to be talking about consent, right?
Right.
Do you want a cup of tea before we get started?
No, thanks.
Sure?
Mm-hmm.
Just the smallest drop of tea?
I don't want anything.
You don't want anything? Okay. I make a really good cup of tea. It'll be the best you've ever had.
I'm sure you do, but I don't want
You
one.
don't want a cup of tea, okay. But I've already boiled the kettle. If I don't make the tea, the kettle might explode.
I'm
what
sorry,
do
but I don't care. I don't want one.
You don't want one. Well, everyone else is drinking tea. I mean, are you sure you'll feel a bit stupid if you're not drinking
I
tea?
don't care. I don't want one.
You don't want one, okay. You don't have to do anything, I'll make the tea, you can lie there, I'll just pour it down your throat.
How weird is that? I don't want one.
You don't want a cup of tea? Well, just, because we're having this chat, most people drink tea when they
Oh, my
chat.
gosh.
It's sort of like, I assumed,
How many times do I have to say, just get me the tea?
Right, I'll get you the tea, hang on. Hey, there's your tea.
Thanks.
You gonna drink it then, or what?
No, I told you 5 different times I didn't want
Right,
it.
okay, so I've gone to the trouble of making the tea and now it's here, you don't want it.
Why are you being so weird about tea?
Am I making you uncomfortable?
Yes.
And that is consent, my boy, right? If she says no, she doesn't want to do it. And if you constantly try and convince her, even when she eventually says yes because she's so sick of you moaning, she still doesn't want to do it. And that is non-consensual. Do you understand?
Yes.
Excellent, lesson learned. Just so we're clear, that tea is a euphemism for...
Sex.
Yeah, it's for sex. And actually, if you're not going to have that cup of tea, I will, because I'm absolutely gasping. So as the parent of a 14-year-old boy, sometimes you've got to have conversations that you don't really want to have. Well, he doesn't anyway. But it's important, conversations like the birds and the bees, for example, or how to behave when you're out in public so you don't embarrass...
You're back.
Great. I like her humor. And that tea analogy is, as she said, famous. I did include the link to the original on YouTube for people to check out.
If you're still struggling,
There's also a second link to the same YouTube channel about bodily autonomy for younger kids, not about sex.
Okay.
Yeah, Rachel Bryan and Emmeline May, I think, is who. Yeah, did the Blue Seat Studios tea analogy, and then Blue Seat Studios also did a version for younger kids on bodily autonomy. Um,
Nice. Okay. And also somebody else posted another version that's of the illustrated cartoon variety. So that looks really cute. Um, would you mind if we played that one as well? I think it looks interesting.
yeah, no problem. I want to make one quick comment about that particular video is a great example of gentle coercion.
Tell us more.
Oh, sure. Gentle coercion is the term that is often used for this pressuring of like, don't you want tea? But I make a great cup of tea. You're weird to not want tea. And the person finally says yes, just to get you to shut up. This is called gentle coercion, aka badgering. So, but the term that is currently being used for it is gentle coercion because it's not aggressive, it's not in your face. It might be that coworker that asks you out time after time after time or something like that. This is called, I'm sure this people know this, but in my practice, we use that term gentle coercion.
There's that there's that Christmas song that's really creepy of like it's cold outside.
Mm.
And
Oh, yes, that Christmas song.
it's creepy. And at
Yeah.
one point it was considered sexy. And all I can hear is gentle coercion and creepiness. So, ew.
Yes.
Yeah. Let me play this other video and then I want to get back to the value thing, right?
Hmm.
And all the resources online. Oh my God, but here's another resource. Okay. And oops, get the screen to fix itself. How do I make this thing go away?
If you're still struggling with consent, just imagine instead of initiating sex, you're making them a cup of tea.
You say, "Hey, would you like a cup of tea?" And they go, "Oh my God, I would love a cup of tea, thank you." Then you know they want a cup of tea. If you say, "Hey, would you like a cup of tea?" And they're like, I'm not really sure. Then you can make them a cup of tea, or not, but be aware that they might not drink it. And if they don't drink it, then, and this is the important bit, don't make them drink it. Just because you made it doesn't mean you're entitled to watch them drink it. And if they say, "No thank you," then don't make them tea. At all. Just don't make them tea. Don't make them drink tea. Don't get annoyed at them for not wanting tea. They just don't want tea, okay? They might say, "Yes, please, that's kind of you." And then when the tea arrives, they actually don't want the tea at all. Sure, that's kind of annoying as you've gone to all the effort of making the tea, but they remain under no obligation to drink the tea. They did want tea, now they don't. Some people change their mind in the time it takes to boil the kettle, brew the tea, and add the milk. And it's okay for people to change their mind, and you are still not entitled to watch them drink it. And if they are unconscious, don't make them tea. Unconscious people don't want tea, and they can't answer the question, "Do you want tea?" because they're unconscious. Okay, maybe they were conscious when you asked them if they wanted tea, and they said yes, but in the time it took you to boil the kettle or brew the tea and add the milk, they are now unconscious. You should just put the tea down, make sure the unconscious person is safe, and this is the important part again, don't make them drink the tea. They said yes then, sure, but unconscious people don't want tea.
I'm back. To the person who shared that, thank you very, very much. So around, okay, so we looked at a couple of videos. You're also sharing many other resources, and I'm assuming there's a ton of resources online as well as in book form for parenting.
Hundreds, if not thousands, of resources.
That's a little overwhelming. And earlier
It
you
is.
suggested about having a sense of one's uh, caretaking parental value. So I assume a little bit of inventory on that. You mentioned words like, what was it? Empathy, kindness. In terms of having those to think about it in advance, right? So I can get people who are planning their having their child, uh, whether by birth or adoption or whatnot, and they're preparing themselves. Okay, fine. But I'm going to give you a scenario. Okay.
Bring it. Let's do it.
Okay. So, as many of you know, I am a cat mom. I have cats. Um, Cats are masters at setting their own boundaries. They don't give a shit about other people's boundaries. That's cats. I don't have children. I have never wanted to have children. However, I have friends who have children. Okay, so knock on wood. Let's hope nothing happens. I'm thinking of a couple of my friends who have a small human. Um, 4 or 5, I don't know, small. See, I can't even tell children's age. Oh my God. Um, so let's say something happens and I end up Auntie Mame style, but with a small human. Uh, let's just decide on an age, 5. Okay.
Okay.
5-year-old. Suddenly I have this kid and I have to be caring for the kid. Um, this is kind of a lone wolf and cub situation. For those of you who love Japanese movies, check it out. This is a kind of a not good example of solo parenting, but it's a sword movie. So, but let's say Midori today ends up with a 5-year-old, had no plans of it, have never thought about parenting value. I know how to clean the litter box. I don't think that applies. So talk to me on questions I should ask myself before going online and feeling completely inadequate and overwhelmed.
Mm. Well, you're going to feel inadequate and overwhelmed as soon as that kiddo shows up. And this is true, I think, of anyone who's a caregiver,
Mhm.
whether it's a child or we're caregiving maybe to an adult. But sure. So, that's such a big thing to be hit with, the responsibility of another human being, um, unprepared, not maybe, you were listed as a godmother or something, and it's like, well, now it's down to you. Uh, of course, let's take the like very practical things and put them over to the side, which is how are you going to handle childcare? How are you going to handle the finances? How are you going to work and have a kid? Do you have the means to not work? Do you have support? All of that. Let's set that to the side. And let's just talk about how you're going to interact with this child. Yeah, I would say that I would start with parenting values. What is it? I have to assume you've met this 5-year-old, right?
Yes.
Let's assume.
Mhm.
And I'm like, tell me about this kid. And I will take what you say, this child that you describe, these characteristics,
Mhm.
and I would be like, Midori, what do you think a child with these kind of characteristics needs to grow up to be a functioning, healthy adult? And you'll start naming off things. Okay, so how do we help you help this kid get those things? And a lot of times that's when parents are really going to start naming their parental values, their parenting values. And it is often the most common things I hear are kindness, empathy, patience. But I often do hear other things like creativity,
Mhm.
independence, and how you parent has to reflect those things. And sometimes I'll challenge parents as time goes by if I see that, like, what their behaviors are not aligned with their values. I'll ask parents, it's okay to just come to me and be like, I messed up. Okay, break it down for me. What happened? Or, my 5-year-old little Susie just won't stay in their own bed. And maybe that's a boundary for you, right? How do we navigate that with patience? But let's say maybe one of the values you came to me with is creativity. Let's use it. If we're trying to teach a child creativity, let's lean into that value and talk to Susie about why this is happening and help her problem solve. Now, generally, sleeping in the bed with a parent is something that people love to argue about. I don't really have an opinion as long as the kid is 10 and under. I don't really have an opinion. But parents get to have boundaries, which is something we didn't talk about,
Mhm.
is like parents and their children violating parental assent and consent. But anyway, yes, looking at those values is where we would start because that's going to inform your parenting style. That's going to influence your techniques. We would talk about tips and tricks that are aligned with your values. Now, sometimes I will have someone whose values are interesting, like the biggest thing they value is compliance. Now, that's a tough one, right? Of course, we want children to comply, but is that really the biggest, But sure, sometimes that is a parenting value is high compliance. And then we have to break that down. I want more information.
Mm. Uh, that brings to mind like the dad in Sound of Music, right? And whereas the stand-in parent Maria had a very different set of parental values.
Mm-hmm.
Now, back to my hypothetical situation, again, knock on wood, hopefully it doesn't happen. Um, I would have to struggle through the parental value thing. And this conversation I would find rather helpful. And for those who might not have a Dr. Megan in your back pocket, it might also be a conversation that maybe my bestie could help with as like sounding back. Given that all that's going on in my life, I feel like I would should probably write down my parental values. And now, based on the parental values that I've come up with your help, now I'm going online.
Mm-hmm.
How do I make the judgment of this with the infinite supply of things out there?
Sure. I would suggest prioritizing the values. I mean, they're all going to be important. But let's say kindness is for you the top priority to raise a kind child. Now, that doesn't mean your child is only going to be kind. It's just the one you want to focus on. Because there's so many resources, just start with that simple Google search of how to raise a child with kindness.
Right.
Just start that simple because it's going to get overwhelming very quickly if you start to look at different parenting styles, let's say, like authoritarian versus authoritative versus gentle parenting. And there's so many different opinions on each. I mean, even gentle parenting, people are constantly arguing about this one parenting style. So instead, go for the qualities that you're looking for.
Mhm.
So I usually have people I navigate them towards look for qualities in the materials, the quality that you want to have in your parenting, not a parenting style, because parenting is so nuanced. It is, again, culture, family culture. It is your parents, how they raised you. And we didn't even get into how that affects consent and assent. Um, and it's just so multifaceted that every parent is different. Even two parents in the same home are going to parent differently. And siblings, let's say you got that 5-year-old, but along with that 5-year-old came a 7-year-old. They have to be parented slightly differently.
Mm.
So start with the quality, do a Google search for how to parent children with, like how to raise empathetic children, how to
Mm.
raise kind children, rather than looking at gentle parenting, authoritative parenting. And of course, authoritarian, none of your listeners are really going to be authoritarian parents, but I met a few. They still exist, but quality over like the quality over the type of parenting.
Okay. Okay. Uh, Very helpful. Oh, somebody suggested, can we get a pocket-sized Dr. Megan with bodily autonomy advice action?
In those moments where a child is like, no, you can't wash my hair. You're gonna wish you had a pocket-sized parent coach being like, just breathe, just breathe, just breathe, just breathe.
Box breathing. Yeah.
Ground, center, attempt to gain your child's assent.
My goodness. Yeah.
And again, I love creativity. I love playfulness. And I often am like, make it into a game, make it into a pretend, make it into find your inner kid and let's play with that shampoo, right? Get a mirror, a hand mirror out. Let them shampoo it up, put it into a mohawk. How do you get children's assent on their terms? Like getting them to participate so that you're actually getting this thing that parents say they want, which is compliance.
Mm.
You can see how interwoven assent, consent, compliance, um, just everything is kind of woven in together.
Yeah. And my hypothetical scenario, I hope it never happens because I want to be that like nice adoptive auntie that just comes in and like, oh, let's go and like give the child back to the to the caretakers. Oh my God. Um, and as we're wrapping this up, uh, and usually I ask my guests around some thought exercise or homework, if I will. Um, yeah, got anything for us?
I feel like if people are really, if you're feeling stuck
Mhm.
as a parent, reflect back to your values. And it doesn't really matter what the problem is. Is it about consent? Is it even about getting that homework done?
Mm.
Rather than pushing hard against your child's will, reflect back on actually, let me bring myself back to my parenting values. Write it down, make a list, like you said. Um, because often all we need often to come back to our parenting center is to take a moment to be like, what is it that I'm trying to do here? Is it patience? Is it kindness? Is it empathy? Is it creativity?
And it seems like for any of us who might out there, like me, who don't have kids, but might, for whatever reason, maybe you're godparent, might be a good idea to think about this. Yeah. Um, yeah.
I mean, what if you approached all your relationships like that with these values?
Shock and awe. Oh, we've got some, as we're wrapping this up, we've got some reflections from those in the audience. Uh, let's see. Someone jokes, reach for the psychedelics when you're having like the parental stress. Okay. But another writes, lots of thoughts on how to manage discussion about bodily autonomy, consent, and bath time type situations.
That
Another,
because I get them so much in my work, the bath
yeah.
time situations. Yeah.
Hmm. Interesting. I come from a bathing culture where the entire family went out to like the public baths, and I think that kind of made a difference, you know?
That
But
makes sense.
conversation for another time on that. I love the communal baths. Uh, Another writes, it's been great. I love the focus on values as a starting point. Also, concrete real life examples and the emphasis on the grace of non-judgment.
Mm.
So, so helpful to understand privacy versus secrets and assent versus consent. I appreciate expanding my understanding.
Oh, thank you.
Yeah, and to the live audience, any other reflections appreciated? And for me, I am incredibly grateful for you taking the chance and consenting to my invitation to come and talk on this because it's with every guest, I learn so much, and this is a field that I have been absolutely baffled about. So I really appreciate this. And I hope that you might come on again and talk about other things like, well, we didn't get to talk about what if when the kiddo steps on our autonomy, assent, consent boundaries. So
Yes, the flip side of that coin.
yeah, so maybe another
Yeah.
on that. On that note, giving a moment for anyone to write in a note, but I'm going to stop the recording a moment and give folks who are here live to ask any questions on that. So, for those of you who are watching this and recording, thank you very much for spending time with us. And consent, well, we got to build our consent muscle on a daily basis. And the special shout out to my Patreons who make this possible to bring it to the public for free and to have these deep, thoughtful, long form conversations. So thank you to my Patreons. And if you're not part of my Patreon, come join. We've got lots of great conversations going. So until the next Consent Dojo,